Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. So today we are going to discuss about what are the symptoms of bulky uterus. So bulky uterus presents itself with menorrhagia. If you've seen our videos, you experience certain words like, hear words like menorrhagia, metrrhagia, polymenorrhea, oligomenorrhea. What are these words actually? So context, you have to remember just menorrhagia as of now. What is menorrhagia? When there is bleeding which is prolonged, okay, if your usual menses or menstruation is 5 days and you're bleeding for 10 to 15 days, that comes under menorrhagia. And the second thing, even if you're bleeding for 5 days, the flow is so profuse, it has clots also, or even without clots the flow is profuse, that is also called as menorrhagia, right? If the flow is heavy or the number of days that you're bleeding is more, all of these come under menorrhagia. If there is bleeding in between your periods, that means on June 20th you got your period, on July 20th you got your period, and again in between, that is after 15 days of your period appearance, you're again having spotting and all, then that is called as metrrhagia. Okay, so here we will experience menorrhagia. Some people experience pelvic pain and pressure, especially people who are doing software jobs or desk jobs. The students, complain about this, but there are housewives who experience it but do not have a complaint against it. Remember, either you're a housewife, you're a working woman, or you're a student. If there is any change in your body which is not like the previous day or which is not like the previous month that you experienced, please note it down because it might be very helpful in evaluating your case. Sometimes you don't have to do a lot of investigations to know what disease you're suffering with if you have already known the symptoms properly. So this is important. Housewives do not complain of this because it's just like, I'm doing a lot of work, I don't have to complain about this, or I'm doing a lot of work, it might be because of that, I've dusted the house today, it might be because of. There are no might be's or could be's or would be's here. You have to understand if there is anything which is abnormal from the previous month or from the previous period, please do note it down. It is very helpful so that you don't have to undergo a lot of investigations, right? And then there is abdominal bloating 10 days before period, 5 days before period, on the day of period you experience abnormal abdominal bloating where your face is feeling a little puffier, there is water retention, the food that you're eating is like it's like it's stuck in the stomach for hours, you have belching, you have irritation, some people even pass flatters a lot during this period, some people experience increased gastric motility during periods or before periods. If you're experiencing any of this which is abnormal from before, please do note it down. And if you're starting to experience even bloating also, you have to note it down because it can be because of some hormonal fluctuations which have to be taken care before the actual disease itself appears, right? And then we have frequent urination, which is actually a combination of bulky uterus along with fibroids. Then you have this frequent urination problem. Frequent urination can be physiological in certain section of people, and also frequent urination can be physiological when you're under really cold conditions. But if there is normal condition, normal state, and you're experiencing a little bit more amount of flow in the urine, it can be because of your increased glucose levels, or if the flow is very less, that is the amount of urine you're passing is less, but you feel the urge to go, it can be because of fibroids or bulky uterus. Also, it can be because of any sorts of cysts or pressure on the urinary bladder as such. It can sometimes be because of stress incontinence, which is when you're coughing, you feel urine spurts. Okay, it can be n number of causes for this. If you are experiencing some sort of menstrual irregularity along with frequent urination, it can be some problem in the uterus itself. Some people experience constipation, which is usually also because of uterine fibroids and combination of uterine fibroids with bulky uterus. And also some people don't feel like eating a lot of fiber during their menstruation, so try including fiber because that will help in better bowel movements. If you have constipation, then that can also lead into hormonal imbalance and improper gut health, remember that. And then some back pain issues, surely because there is bulky uterus, you will be having ligaments which are being pulled, that's why you can experience back pain, which is not usually because of the skeletal problems or the vertebral problems that we can say, it is because of the ligament pull or the tendon pull that you are experiencing. And then fatigue and pallor, some people do experience loss of energy 5 to 6 days before the period, the PMS period, and even during menstruation, that is common. and pain during intercourse is something which is called as dyspareunia is also experienced. And then if this miscarriage or fibroids are not taken care of, they can give you pregnancy related problems where there is risk of miscarriage, that is you're not able to hold the baby properly. Secondary, if it is complicated with PCOS or fibroids, you might be having difficulty in conceiving as well, because if the fibroid is in the fallopian tube, or if there is PCOS with anovulatory cycles, you might not be able to conceive also, right? That can also be a problem. And there is visible swelling, that is in the lower abdomen. If you take, there is visible swelling of the abdomen in people who are suffering with bulky uterus and the endometrial thickness is too much, that is it is more than 12 mm in some people, they can see visible swelling of the abdomen, which has developed slowly in years for some people, in months for some people. Coming to the consultation options, we have discussed how homeopathy is the best form of medication for lifestyle disorders. Here we are discussing how Fidicus Homeopathy is much better. At Fidicus Homeopathy, we have two kinds of consultation options. The one is the online consultation. The second one is the offline or in-person consultation. If you are staying nearby the nearest branch of Fidicus, you can come and contact us in person. But if you are someone who is staying far away from us, you can contact us online through audio consultation option or through the video consultation option. Once the consultation has taken place, the investigations are verified and the medicines need to be given, especially to the online clients. Medicines will be door delivered to you. If you're staying in India, 3 to 4 business days, USA 3 to 5 business days, across the globe anywhere, 4 to 8 business days, our medicines will be taking to be delivered to your doorstep. If you would like to contact us, you can contact us on this number. You can call us, WhatsApp us or message us on this number. And if you'd like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. Here we have seen how homeopathy works best for lifestyle disorders, right? Here we are discussing why Fidicus Homeopathy is the best option in all homeopathic hospitals. Fidicus Homeopathy stands for highest chance of health. Here we are following three major principles. One being, we are experiencing high success rates in adenomyosis, endometriosis, bulky uterus, fibroids, PCOS, PCOD, dysmenorrhea, cervical erosion, and even PIDs, right? So the success rate is really high. And second is the transparent treatment. There is no gray area between the patient and the doctor. The prognosis will be clearly explained to you. And the third thing is the personal care here at Fidicus Homeopathy is top notch. Any sort of queries, myths or questions that you pose us, we will be answering it to you. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.